I don't know of anything that has attracted more patient interest in the past 10 years in dentistry than bleaching. It's really come on the scene like a hurricane or tornado and created a lot of interest, and it's a good thing. It gets patients interested in their teeth, and that's a good thing. But it's also created a lot of confusion. I want to try to simplify bleaching a little bit, at least from an educational standpoint, and talk about 3 different types of ways to bleach your teeth. The first is basically over-the-counter or consumer-driven, and the most visible product now is probably Crest white strips. The product itself does a good job of explaining that, so I'm going to refer you to the product literature that you can look at when you're in the drugstore looking at the various bleaching agents. All of these agents sold in the drugstore are consumer grade. What that means to you is that the bleaching material itself is a little bit more dilute, not a little bit, a good bit more dilute than what a dental office would supply. The reason for this is that the higher the concentration of bleaching gel, the more potential there is to do damage, say, to the gums. So with the higher concentrations, it requires more supervision. There are certain bleaching gel concentrations you just would not want to put in a drugstore and let patients use on their own. Even with instructions, they could do some damage. So what that means is it's going to take you longer to bleach your teeth, and the end result will probably not be as light or as white as you could get with some of the products available through dental offices. So that's the first type. We'll call that the consumer type bleaching techniques. The second type is the other end of the spectrum, which, for lack of a better term, I call power bleaching because that's a popular term. we're going to show now the device that we've used in our office for power bleaching. I mentioned that there are 3 types of bleaching. The best way to describe this would be weak bleaching, which is a consumer bleaching, average bleaching, which is the last one I'm going to describe, and the very strong bleaching, which is what I'm going to describe now. Strong bleaching is power bleaching. Now, the most important thing to remember is that the strong bleaching, you use a much higher concentration of the bleach. The bleach that we use is usually carbamide peroxide, and it's very strong when it's in higher concentrations, 20 or 30%. As a matter of fact, at that percentages, you really don't want to get it on your gums, and if you do, you want to rinse it off immediately. Therefore, it has to be supervised in a dental office. The bleach that we use with the third technique that I'm going to show, which is tray bleaching, is a 10 or 15%. That's stronger than is available in the drugstores, but as I will mention later, it's strong enough to get a very good result. Now, there are ways to take the higher concentrations of bleach and actually make the bleach come out quicker. And the bleach itself is hydrogen peroxide, and that is by applying a light with it. And that's what this gizmo is here. This is a special light we use to increase the effectiveness of the bleaching material, and that's, of course, in the dental office. And that's how it gets its name, power bleaching. So we're going to go to the mouth now and show how this actually works. Most offices that offer the power bleaching do the power bleaching appointments in 1-hour appointments. But in order to do an hour's worth of power bleaching, the appointment has to be longer than an hour because it takes a little while to set this up, as you will see. What we do is we isolate the mouth by placing what we call cheek retractors or lip retractors in place. And the lip retractors, of course, get the lips out of the way. Then we would put cotton rolls in the floor of the mouth to keep the area dry. Then we would protect the gum by placing a material over the gum that's then cured with a special light. And that material gets rubber-like, and it keeps the higher concentrations of bleach from injuring the gum. Then the bleach is placed on the teeth, and it has to be reapplied every 15 or 20 minutes because it dries out with the high intensity light. And the bleach itself is really what does the bleaching, not the light. The light does increase the intensity a little bit, but the main benefit is from the higher concentration. Lasers do the same as light. They don't do it any better. Patients perceive that lasers do it better because it sounds more high-tech, but so-called laser bleaching is no more effective than light bleaching. So after everything is set up and isolated, the light is brought into place, and an assistant would be in the room or nearby, and the patient just relaxes and enjoys it for an hour. Bleaching is unique because it's one of the things in dentistry that dentists have had to learn about almost at the same time patients learn about it. In other words, when something comes out, we don't know that much about a newer technology. We have to try it out and see. And that's what we did with the bleaching, the power bleaching. We were told by the manufacturer, the people selling the light, that one 1 hour session would bleach the patient's teeth to the level that they'd be happy with. And we took them for their word, and we got the system, we started using it, and we found out that 1 hour of bleaching did lighten the teeth, but it didn't lighten it to the level that the patient was expecting, or quite frankly, to the level that we'd been seeing with what I'll describe in a moment as tray bleaching. And I talked to other dental practices, actually from around the country, about this, and everybody was having the same experience. It took not just one 1 hour session, but 2 or 3 1 hour sessions. And many offices were using the tray bleaching anyway, which I will describe, to finish it off. Well, the problem is economics. Any dental practice has to charge a certain amount of money to tie up a chair, an assistant, and a certain amount of the dentist's time for an hour, hour and a half. So it becomes very expensive. For that reason, we don't use power bleaching that much anymore. We've gone to the tray bleaching. So now I'm going to describe tray bleaching. The third technique I'm going to describe is the so-called tray bleaching. And tray bleaching is by far the most popular method out there, at least of the methods offered in dental offices. And we start by taking impressions of the patient's teeth, and we make models of the patient's mouth from those impressions. And on those models, we make special trays that fit the patient's teeth exactly. And these trays, we call them hold the material. So the way this works is that we recommend that patients do this before they go to bed at night, and they will place the bleaching gel that our office will supply in the trays and place it in the areas that you want to bleach teeth. In other words, if you don't want to bleach the back tooth or two, just only place it more in the front tooth area. And just place a small amount. You do not have to fill the tray up, just a little bit. And then when you place it in your mouth, if you see a lot of material come out along the edge of the tray, that means you placed too much material. If you have a sense that you didn't put enough in to cover the teeth, then next time place a little bit more. And you would do the same thing for the lower arch. Place material in, place a tray in the lower, and then just go to bed. Now, an alternative technique is to do the same thing an hour and a half before you go to bed, and then take it out right when you go to bed, and that way you bleach for an hour and a half. But it's actually usually more effective to just put them in before you go to bed and leave them in all night while you're asleep.